Because if I do it and then realize that I didn't record it, it's going to be like disaster. Hello everyone, my name is Dr. Tahia and welcome to my YouTube channel, Talkative Tahia. This is my first YouTube video, so I wanted the topic to be extra special and something that people are really looking for, which is information about the COVID-19 vaccine. Now, we've been hearing about the COVID-19 vaccine everywhere, TV, news, social media, radio stations, from our friends and families. So I have been hearing a lot of questions from my friends and families as well. And I wanted to do a video to clarify them as well as everyone else who else is confused about this particular topic. So I have joined hands today with my friend Dr. Madhusha Vitanage from Northwell Health System in New York City. So let's talk to her and hopefully you get some information from our discussion. Okay guys, so as promised, I have my friend Dr. Madhusha Vitanage with me. She works for Northwell Health in New York and she has lots of valuable information for us. First of all, to give a little intro to Madhusha, I've known her since 2015. We worked together until 2019 and then she left me and went to New York. And she has two beautiful sons and we actually went through a lot of things together. We went through like pregnancy together. We were friends pre-baby and now we're like moms. So we have a lot of things binding us together in our friendship. And also she's a fashionista. If you guys want to follow her. She loves fashion. She loves purses. I'm jealous of her purse collection. So, and one of these days I'm just gonna like steal some of her purses. If I go to New York, you're gonna see some of your purses missing. Anyway, so let's get to the point. So Madhusha, how are things in New York right now?
So thank you for inviting me to this.
You are
so good to see you. You look fabulous.
Thank you.
Yeah, so in New York, compared to when we were the epicenter in like March or April, compared to that, we are like really doing much better now in that sense, if you compare to. But of course, with the second spike, now we have the cases are going up. And I think the hospitals, maybe they are much better prepared this time around because we have the experience from the previous. Yes. Also, like if it with the numbers, like, I took this sometimes from the governor's site, like yesterday, as of yesterday, like total COVID hospitalization, they were about 5,321 cases.
Wow.
And we have done
currently 5,000 people are in
hospital? Just yesterday. Yes.
Oh, wow. Wow.
And then they have done 212,672 tests. And then 10,595 cases were positive. That's about, yes. So that's about 4.98%.
Yeah.
So you see, like, it's really not good. But the hope and the light at the end of the tunnel is the vaccination, I think. Yes. So I think that's what right now, I'm really excited.
Yeah, that's our kind of like our topic for the day. And but before I start, I just want to talk about the numbers in US as a whole. So as of 2 days ago, that's when I got my numbers. The US had 15.2 million cases till date. So starting from the pandemic till now, and then obviously the death rate is like more than 286,000 today, as of today. And every day, it's like we're losing 2,000 lives every day. That's the cycle. And also 20,000 people getting affected every day. So testing positive. By affected, I mean testing positive. And you live in New York. You just gave me the New York data. I live in California. So in California, we have a total of 1.43 million cases. And more than 20,000 people have died from it. So things are not good. I mean, even though, there's the vaccine coming out, the US, you would think as a first world country would do so much better. But unfortunately, the numbers are showing something completely different. So let's jump into like the front runners who are the companies who are developing this vaccine or already got approved for it. The number one company would be Pfizer BioNTech. So they got approved on December 8th in UK and in Canada. And then good news is as of yesterday, it got approved in US. Yeah. So do you have anything to say about the approval, like what's going on or something like that?
Yeah, so I know in like Pfizer BioNTech, so I think in the US it's November 9th, like they asked for the they went through and asked for the approval process to be begin. And then I know like the November 20th, that's when they applied for the FDA approval. And then they went to like the FDA regulators review and then the effectiveness, safety, and all after those reviewed, December 10th, they voted for it. And then, of course, yesterday, December 11th, that they authorized it.
Yes.
So regarding the Pfizer BioNTech in New York, I know the first batch of that's what everybody's excited about. So in the state of New York, we were expected to get 170,000 doses.
Okay.
So they were to come like this weekend and then to be distributed to hospitals, and even in my facilities, we were expecting by December 15th that we could initially start give the vaccinations.
So after Pfizer, I think the next big one for US context would be Moderna.
Yeah.
And with Moderna right now, what I'm kind of unsure about is what stage of approval are they in?
So right now it's undergoing through that FDA regulators reviews, and then the effectiveness, safety, and whatever the data. So next would be that after the reviews are completed, the FDA would be voting for it. So I think that's where it is right now. So we don't really have a timeline when they would vote for it, but they expect before the end of this year that it's gonna come.
Because I mean, obviously, if you think about it, just the Pfizer vaccines which are going to be available this year and even next year, the number that they have, I will talk about those numbers in a little bit. They're not enough. So we need the Moderna vaccines to come in as well. Right?
Exactly. So actually, from the governor's side, I actually saw like yesterday, they said they are expecting 346,000 doses to get into New York State by December 21st.
Okay.
So hopefully, before that they approve it. Yeah, so we have it readily available.
Yes. And then the third vaccine that actually people in third world countries, like my country, I'm from Bangladesh, and that my country, along with some of the European countries and Asian countries mostly, are most excited about is the Oxford vaccine that they're making in combination with the AstraZeneca pharmaceutical company. So that one, I know that they're still, going through some trials, some of their last stages of the trial. They do want to submit it to the regulators for approval soon. But as of right now, I'm talking about as of 2 days ago, their dosage and how many doses they would end up needing and all that stuff, it's still under trials. But one thing about AstraZeneca vaccine, which I have seen, is that they're the first ones to publish their data in a peer-reviewed journal. So Pfizer and Moderna have not published. Yes. So that's one good thing about AstraZeneca. And I know AstraZeneca, a lot of people are excited about their pricing and everything. We're going to get into that in a little bit. Since Pfizer vaccines just got approved, if my numbers are correct, 2.9 million vaccines are ready to head out in the US right now from Pfizer. So I know every state has their regulations and their numbers, but I know in the entire US, what they're doing is they want to categorize the frontline healthcare workers as well as residents of long-term nursing homes, right? So together, if I talk about California, you can talk about New York and jump in with New York later. If I talk about California, in California, they need that number of people. It's 2.4 million people, the front runners and the nursing home residents. And that's just the first phase. That's what they are, they divided up into a couple of phases. So that's just the first phase. And right now they are going to be receiving 327,000 vaccines. So that is, if you see, that's nearly not enough. That is not enough. We need 2.4 million and we're getting 327,000 vaccines. So what they're doing is they're further triaging that first group. So they're going to give it to people not just working in hospital, not all frontline healthcare workers, but the ones who are only seeing COVID patients. And also like, nursing home residents who have pre-existing diseases. So they're further categorizing it. What are they doing in New York?
So it's the same. Like, I think the state gives like guidance, but I think what I heard from the governor, it's up to each individual hospitals to decide how they would distribute the vaccine and how they would prioritize. You get the frontline healthcare workers and then the long-term care, elderly people in the long-term care facilities.
Yes.
So I know even in our hospital systems, we don't really have like much information because, these are inside informations, but they do have what I heard, they have like an algorithm where they would feed in the data, and then they would have, how old are you? Like, what are the pre-existing conditions?
Mm-hmm.
And then, depending on that, there would be like an algorithm there. They would get the people who they would prioritize.
Mm-hmm.
So of course, I heard it's the first probably ICU work staffers, emergency room, and then maybe of course the older people that's in the long-term health care.
Yes. When it comes to the vaccine, the US actually needs 24 million vaccines for those first phase, for all the country's frontline healthcare workers and all the nursing home residents. So there is about 15,000 nursing homes that are expecting the vaccine in that first phase. So we need 24 million. Obviously, we're not getting that right now. But eventually we would need to depend on those Moderna vaccines to come in as well, which together will equal to 40 million vaccines, Pfizer and Moderna. I'm sorry if I'm blurting out a lot of numbers, it might get confusing, but I wanted to make sure that people understand that if we want to vaccinate that first phase group that was categorized, we need about 24 million vaccines, which we can only get at this point is if we also get the Moderna vaccines coming in, the approval coming in. Right now, 27 states are falling short. And we already talked about California and New York, what they're going to do with this shortage. Yeah, that's the thing. And I know that it's a little bit frustrating for a lot of people who don't fall in that first or second phase of people who are going to be getting it. But at the same time, we have to respect the fact that there are people who need it more, because if you think about, for me, I'm working right now, I'm at home, and yes, my husband's going to work full time, but maybe I would want it for him. But at the same time, he's not a high risk group. He's a young, early 30s guy, So definitely as doctors, both of us, we need to respect the fact that people need it more. There are other people who need it more. So maybe if we sit tight, hopefully, everyone's going to end up getting that access to the vaccines.
I think the timeline is by the end of next year, by the, I think end of the late summer, everybody should, at least the adult population, they should, the vaccine should be available for them. So
when we do get the vaccines, let's talk about where we can get it. So what I've heard is we can easily get it at the locations that we get our other vaccines. So that would be, physician's office, hospitals, and then, grocery stores like CVS and Walgreens. I know those are key partners to where you can get those vaccines. And also it's most likely going to be covered by your insurance. And if not insurance, then Medicare or Medicaid, they are going to cover it. So it's going to be free of cost and available at the locations that we usually get our vaccines. So let's jump into the vaccines and their details. So Pfizer, BioNTech, and Moderna are the mRNA vaccines.
Yeah.
And this is confusing a lot of people. They don't know what mRNA is. People who don't have that medical and health background, it's confusing. I mean, it took us a while to learn about what mRNA does and what it is and all that. So, and then the AstraZeneca vaccine it uses an adenovirus vector. Do you want to explain the difference between mRNA and the vector vaccine, the adenovirus vector vaccine, in easier format?
So I think that the whole confusion with the vaccines, I think, because was a new technology, we are using it the first time. So I think many people have a lot of confusion. So generally, when we get our older vaccines, normally what they do is you get the whatever the bug, if you say, or the virus, we normally use the weakened or we dead virus, and then that's what we used as a vaccine. You inject and you make a immune response, and then we get antibody production in that way. So that's how traditionally the vaccines worked.
Yeah.
But in this mRNA, the technology, what they did was they got the translation from the genome, the code for the protein where the COVID, SARS-CoV-2, that, and then they genetically engineered that mRNA. So
it's like an instruction kind of, right?
Exactly. It's so when they inject to the cells this mRNA, so it's they get into the ribosome and they instruct to make that SARS-CoV-2 spike protein.
Yes.
So when they make this spike protein and then it released to the body or the bloodstream, now our bloodstream and our immune system, it thinks, oh, we have the infection. But actually this is the spike, the protein
it's not the infection per se.
It's not the infection. It's not like the real disease we have. The cells and then the B cells, they're going to produce the antibodies. So the antibodies from B cells is what that blocks the virus from infecting the healthy cells.
Yes.
So we are just introducing the information to make that specific protein.
Yeah. So that the immune system can kind of basically, like you said, create a defense against the COVID, which is by creating the antibody.
So because when the body sees this antibody for this protein, that it doesn't really know this is not the real virus.
Yes.
Because it's gonna think, oh, that you have this unknown virus, the infection. So now the body going to have that natural immune response to fight against. So they're gonna do all those immunological responses and cascades they go through and go through the immunity.
Yeah, I've had some people message me on Instagram saying that mRNA vaccines will alter our genetic codes and our, the way our cells are formed and our DNA structures and all that. I just want to kind of touch on this misconception that it's not. It's something, it's just an instruction which is going to be put in our cells to make that COVID protein so that our body thinks it's getting that infection and makes those antibodies for our protection. So it's not like we're going to get the infection. There is we've had historically we've had live vaccines, which create somewhat of a good population of the infection in our system to make those antibodies. But then this one is not that. It falls under separate categories.
Actually, that's the whole thing. mRNA, they cannot really change human genetic code because, our genetic material is really DNA.
Yes,
so, so
this mRNA vaccine.
Yeah, this is just and then even when we introduce the genetic material, we are not even giving the whole thing for the SARS-CoV-2. It's just the SARS-CoV-2, the spike protein. So we are just
so let's come to the AstraZeneca and Oxford vaccine. So what I've learned from several sources is that this is a adenovirus vector-based DNA transfer of material. So basically,
from chimpanzee, I think they use it.
Yes, it's a chimpanzee adenovirus, which is an adenovirus. Is basically a virus that gives us that common cold, and it's a very general small virus, not very severe. So that's why this was chosen, so that it doesn't create any severe responses in our system. So what I know is that part of the DNA of the adenovirus, or the chimpanzee adenovirus DNA, is going to be segmented out and replaced with the COVID DNA. And then that product is going to be introduced into our cells, into the nucleus first, so that it can transcribe into an RNA or messenger RNA. Okay, and then the same thing happens like
and it goes through the same like the Pfizer or the
so
Moderna.
it's not going to come in any kind of contact with our DNA. That is a separate DNA. It's doing its own thing. It's just going to be in the nucleus of our cells. So it's going to be making the DNA template, and then it's going to transcribe into messenger RNA, which is going to come out of the nucleus and basically do the same thing as the Pfizer and Moderna vaccines. Now that we kind of know the basic differences in the make of the vaccines, let's kind of get into some other differences. Like, for example, efficacy. Right.
So I know the Pfizer BioNTech about like more than 95%, they said, and Moderna is about 94% one.
Yes.
And then the AstraZeneca is, I think overall it's 70%. So the interesting part with the AstraZeneca is, the initial when they did the trial, and then the after one when they did the second one in, I think, the UK, they have found out when the dosing, when they did the half a dose, and then at the first dose when they did a half a dose and then the full dose, they actually had about like 90%. But when they had like full dose, the first one and the second one, they had about, I think, about like 60%.
Yeah, 60%.
So I think that's how they came.
Which is weird because you're getting half a dose in that first dose.
Yeah.
Right? You're getting
so
more.
I think that's why maybe it's still like, they are going through. I think they are still trying to come up with maybe what's the optimal dosing.
Yes.
So maybe that's why it's not still going through, like they haven't come to the authorization. Maybe I think
the good thing is that countries which are expecting the AstraZeneca vaccines, they're good to go. They already ordered whatever vaccine they can order right now. And then they're waiting for the approval to go through. So right away they can get those doses. The next topic that we're going to cover when it comes to differences between the three is the shelf life. This is a major, I would say, it's one of the major differences. Again, after the type, this is probably the next biggest. So let's touch on Pfizer. Pfizer, you can refrigerate it, meaning you can keep it in a regular refrigerator for 5 days, and then you can keep it in dry ice chest for 30 days. But eventually, for that long-term storage, you need that ultra cooling freezer, which is negative 94 degrees Fahrenheit. Yeah, that keeps it for 6 months. And we'll come back to this, and then Moderna, it's a little bit better. You can keep it in room temperature for about 12 hours, and then just in a regular refrigerator for 30 days, and then in just a normal freezer for 6 months. And AstraZeneca, I would say, has the best storage shelf life. You can just keep it in a standard refrigerator for 6 months. So
I think that's why, this AstraZeneca might be the, like the vaccine that would go more globally, vaccine of really, just because of the, how the shelf life is.
Yes.
Not every country. And then even within US sometimes, if you get some of the rural areas, I don't know how much, the freezer capacities and, really the availability.
That is one of the challenges with the Pfizer vaccine. So let's come back to the Pfizer vaccine. I know that the Pfizer vaccine eventually, like I said, for that 6 month shelf life, you need to put it in that ultra cooling freezers. I know New York, I saw this a news report in New York, they have about like 7 or 8 spots where they can store it right now.
Yeah. So I think they have like distributing like centers, but even like within my health system, like we have like, I got this information, like our CEO, Michael Dowling, he had like a news conference. So over there, like he was telling, like we have Northwell have about 19 freezers. And then some of the larger freezers can store up to 250,000 doses.
Okay.
And across all the 19 freezers, they have the capability of storing about 3.5 million doses. So I think within New York, I think, they have the capacity to have the, enough doses stored. But I don't know, major metropolitan areas, they might have this ability, but, but we don't know how it would
Not
be.
about the rural areas
Exactly,
of US.
exactly. So I think it's really challenging how
It
to
is. It
transport
is,
this
and
here.
also, that is, even for countries like the U.S., it's challenging. Think
It is.
about, like, third world countries, or countries like mine. I know that the reason the Pfizer BioNTech vaccine would probably not even be bought by my country. I still don't know yet, but I'm just saying it's the shelf life, because we don't have those cold chain supply to store those vaccines. And even if you think about it, you make it here and then you transport it via plane to other countries. That is a challenge itself,
Yeah.
because that is because
I don't really think so. I think in that case, like in globally, what would be available is the AstraZeneca, I think.
yes,
So
yes.
even like when we see like the doses ordered, actually for Pfizer, they have currently US, they have ordered like 100 million vaccines.
Mhm.
And then Moderna also, they have ordered 100 million.
Mhm.
And then for AstraZeneca, they have ordered 300 million.
Yes,
So
yes.
for globally with the WHO, the COVAX, they have not ordered like zero for Pfizer and Moderna, but they have ordered like 300 million for AstraZeneca. So
Yes,
that
yes.
gives you like,
That gives you an
the
overview
those
of
other
that
countries,
distance.
that's what probably the, gonna be the
Yeah.
vaccine of choice, probably the AstraZeneca.
Yes, yes. Hopefully, I
But
mean,
probably you and me, we would get the Pfizer or
Pfizer
Moderna.
vaccine, yeah, because we live here, and hopefully, whenever it's our turn, most likely the Moderna or the Pfizer vaccine, that's probably what we're going to have access to. Let's come to the cost. So the Pfizer vaccine, they're costing $20 per vaccine.
Yeah.
The Moderna is $15 to $25, and the
That's
AstraZeneca is only
like
$4 to $5. You see,
yes,
there's
and
a
that's
huge
also a
difference.
major factor, because if you go in like either Sri Lanka, Bangladesh,
Yeah.
each vaccine for $20, that's a lot of money,
That is a lot
but
of
because
money
it's
for countries
like
like ours. Yes,
yeah,
definitely. So even if you think about US context, I know they're giving it to everyone for free,
yeah,
but they are having to buy these vaccines.
yeah.
And
They were bought from taxpayer money, so
yes, I mean, one way or another, we are kind of paying for the vaccine. Think about it. Next, let's come to the doses. I know that for all three of them, there's 2 doses each, right?
yeah.
Jump in on
So the Pfizer BioNTech, it's 2 shots,
that.
3 weeks apart,
Mhm.
and Moderna and AstraZeneca, it's 2 shots, 4 weeks apart.
4 weeks
So I
apart.
think in days it's 21 days and then 28 days apart.
28 days, yeah. So it's like there's an estimate that you get so say day 1 you get the first dose, day 12 your body's kind of starting to build that immunity,
The immunity,
and then
yeah.
day 21 you get that second dose for Pfizer, and the other one's day 28, and then it takes another 7 days. So day 28 is when you ultimately reach that full immunity, right?
Yeah.
That's why you
Yeah.
get those 2 doses for any of these 3 vaccines. Next topic that I want to talk about is side effects. Okay. I know this is a very sensitive topic because this is something that's kind of, giving people that second thought about if they even want to take the vaccine, right? So you
Yeah.
want to talk about some of the side effects from the Pfizer and Moderna vaccines that we are expected to have?
Yeah. So for the Pfizer, and they were saying you have the pain in the injection site,
Mm-hmm.
you have fatigue, you
Mm-hmm.
have fever and chills.
Mm-hmm.
And also like in the Moderna, it's like this almost like similar. They have the pain at the injection site, muscle aches, headaches. So all these side effects actually are very common side effects of any
Yes.
vaccine.
Yeah, they're
Like
like
there was
flu-like
not
side effects.
really exactly like when we get the flu vaccine,
Yeah.
normally we have headaches, fatigues,
Mm-hmm.
fever, mild chills, so those were the side effects actually. There wasn't any like, out of really like, serious
Ordinary.
concerning
Yeah.
side effects.
And also,
So,
if you talk to like doctors who are working with infectious diseases, most of them will tell you that you want these side effects. You want these
exactly.
flu-like symptoms to happen after the vaccine, because
That- It's
that's showing that your the system is
Exactly, like your body is responding and, like making these cells. That's what it means.
yeah,
Any vaccine, when we get, if you have a mild reaction, it's actually a good thing. So
yeah.
that means your body is actually doing something that,
Mhm.
it's really making the antibodies and then, making this long last that immunity.
Yeah,
So,
I mean, I remember when I took my son for his vaccinations when he was a baby. His pediatrician mentioned to me right away that he might get some fever, he might be a little bit cranky, and he might be a little bit like drowsy. But that's okay. That is just the reaction of the vaccine, and that shows that it's working in his system. I asked her if I should give him like anything to reduce the fever, and she said you don't need to, because this is just something that happens. So that's the thing, like I'm getting a lot of questions from my friends and family, and they're hesitant about the vaccine. It's because they're saying, oh no, there's a lot of side effects, but these side effects, like they're just the regular common side effects you get after any vaccine, right?
yeah.
So I want to touch on three groups. So I want to touch on what the immunosuppressed people are expected to do when it comes to the vaccine, and then pregnant women and kids, children under the age of 12. So let's talk about the immunosuppressed. I know people who are on immunosuppressants. I have friends who are on immunosuppressants. People who are, maybe pregnant, who are usually a little bit immunosuppressed as well. They're asking if they should even take the vaccine, if the vaccine is even going to work for them.
So I know currently all these three groups, actually, they have not done many studies. So
Yes.
even like this morning, I was listening to in the TV, like some kind of a, like, like a OBGYN,
Mm-hmm.
where they were saying, so it's not really like CDC didn't really recommend for those people to get the vaccination.
Mm-hmm.
So I think it's gonna, at this moment, it's gonna be depending on your, or either OBGYN or whatever the specialty, the physician you're going on. So
Yeah.
I think it's going to be the physician judgment. They are
Yes.
going to look at your benefits and the risks. So
Mhm.
if the benefits, outweigh the risks, so
Yeah.
in that case, that they would decide to give it. So right now, I don't think there's enough information regarding these groups. Like even for the children, they haven't really started like
Yeah.
doing
Right.
any trials.
Mm-hmm.
So I think the only, even it's the Pfizer that who started for, I think, from age 12 and up.
12 and up. Yes.
So
Yeah.
at this point, I think it's really depends to your physician's judgment,
What
I
they
would say.
Yeah, and even historically, like whenever they were trying vaccines, they never really used to try vaccines on pregnant women. So
Yeah.
data for pregnant women when it comes to being okay with the vaccine or something is really rare, because usually they don't want to do something that's going to affect the baby later on in life. So right now there's not much data when it comes to the COVID vaccines on pregnant women, but like you said, it's going to depend on their OBs and other physicians who are in charge of their pregnancy to decide if they want to give it to them. But yeah, like they're open to take it. It's not like the CDC is banning them to take it or anything.
Yeah. I
But
think it's individual judgment and
judgment.
whoever their physicians. Yeah.
Yes, and also when it comes to the immunosuppressed people, that group, I heard Dr. Fauci say it on TV a few days ago that even though their response is going to be not as robust as our response to the vaccine, but still little response is better than nothing, right? So
Yeah.
he's still encouraging people who are on immunosuppressants, who have other health conditions that makes them immunosuppressed, to still go for the vaccine, because it doesn't matter, you will get some immunity is better than no immunity. I know we already touched on the first phase, that it's going to be the frontline healthcare and the nursing home residents. Let's talk about that second group. So the second group who are supposed to get it around February are going to be more healthcare workers, like technicians. And then we have the emergency medical teams, the EMTs, and then the police. So February and March, we're still going to be in that first phase. April is when phase 2 kicks in, and they still haven't decided the group for phase 2, but what we are hearing is that they're going to prioritize teachers from kindergarten to 12th grade, and then other staff of the childcare industry. So, you
And
know,
then
any
the essential, whoever they considered as the essential workers,
essential, yes, yeah,
yeah,
yeah. So childcare, and then also another group that falls in phase two would be the residents of homeless shelters.
yeah.
That's another group that they're aiming for. So that's going to go up to like April. May is, I think, where everyone kind of gets access to the vaccine. May, June. These are people who are under the age of 65 without any pre-existing conditions, healthy young adults and kids. So I'm guessing by the time you and I get access to it, it's going to be like June or late summer, right?
Yeah, probably.
Um, right now, according to a poll, 53% of people in the US are willing to take the vaccine. So if you see that there's still a big number of people
Yeah.
that are not willing to take it. So can you give us like some, like, according to you, what do you think needs to be done to have these people agree to take the vaccine so we can reach that herd immunity stage?
So I think like one thing is like we have to listen to the people, like why they really don't want to take the vaccine.
Mm-hmm.
I think one reason is, of course, yeah, this social media, the internet and everything, there's a lot of information available. So
Mm-hmm.
sometimes there's good information, also there's bad
Bad
information.
information.
So
Mm-hmm.
I think like the people are really confused about the vaccination, like as a whole, and they think, oh my God, it was a robust, or
Yeah.
this was done in a record time, or
Mm-hmm.
it's not safe, or maybe they don't even understand what's mRNA vaccine.
Yes.
So if you get, you and me, we understood because we went to medical school. Sometimes
Yeah.
even I saw some of these polls and I talked with my husband. I was like, wow, why wouldn't people, why this many people is hesitant to take the vaccine?
Yeah.
But then even my husband was saying, we understand,
Yeah.
like because we went to medical school.
Mm-hmm.
Just think that I'm in like a fashion designer, something really unrelated to a medical field, and you don't really know. So of course you will be kind of hesitant, if you think, oh my God, like this is a new vaccine.
Is
So
it
I think
safe
we
or
have
not?
to,
Mm-hmm.
so I think when people are hesitant, you have to listen to the people, like you have to acknowledge them, and then you have to listen why they not comfortable. And then we have to try to give like fact-based and scientifically, like, proven, like the message out there.
Yeah, I think a lot of this is going to depend on the physicians, right? Like to talk to.
And then I think, eventually, I heard that Obama, and then, some of those well-known people, I think there is an effect, some of those the people that's very reputable or we look up to, when they take it, so people get certain, like, security,
Yes,
to
I heard that the ex-presidents, whoever's
like,
they're gonna take it live on TV or something.
Yeah, so I think
just to encourage people to take
it appeals to, certain people, groups, so they feel much more comfortable.
Yeah.
So the other one that I would like to talk about it, how they were saying this vaccine made really like so fast, It's really not necessarily because this was a new technology. So historically, when they have the vaccines, when they develop, it takes like, years to do, because sometimes they had all this legwork. You have to inactivate the virus, you either like, you kill, and then they have had that, all those processes, like to massly, to do those, to inactivation or go through those phases. But this has been studied for a long time. But they did not really get like, get a chance really to do, or like to, but when the COVID-19 and it's a pandemic, and then it's kind of accelerate. So it's the information and the technology, like they really had, they were trying to use, they were in. So it's not something like, oh, the COVID-19 happened and then we just suddenly, used the mRNA vaccine.
Yeah, I heard that the mRNA vaccine study has been taking place since the 60s.
Yes, it's like 1960s. There's, that the start of
the started working. So the base was there.
So they just put things together, and like, so did the.
So it's not, if you think about it, it's not like a fast developed vaccine. It's just that
it's not like the.
Yeah, they had their homework
Studied it
done.
for a long time, you know.
Yes.
It's just like you just use different components and, you know, like do this in a like a
Yes.
record
Mhm.
time.
Mhm.
But I don't think the whole knowledge behind it is really new.
And
So
you have to be like, you have to think about it logically. If it wasn't safe, and if they didn't have good data from their trials, the FDA wouldn't approve it. And that's
yeah,
just the US. You're talking about the UK. You're talking about places like Canada. So these are all first world countries. They wouldn't give it authorization if it wasn't safe enough for people to take. So yeah,
I mean,
I
how did
agree that
the
there's,
Moderna and Pfizer, they did went through, you know, phase 1, phase 2, phase 3
of
trials.
course, yes, of course.
And so, and then even like Moderna, that what I think the phase 3 trial is like 30,000.
Hmm.
It's not really, yeah, maybe compared to maybe the other vaccine, but it's not a small number. And
No,
then, you
yeah.
know, to have a, like a 94.1% efficacy,
Hmm.
that's like a great number.
That's a very great good number. Yeah.
So,
Regardless to say, what I wanted to ask you was, would you take the vaccine?
oh yeah, absolutely. Like, you know, when it's time, I know maybe, you know, I would, because of the hospital, I might get maybe a little earlier.
Earlier, yeah.
I'm not really like, you know, I'm not in patient contact with the
Mhm.
COVID-19 patients. So I'm sure I'm not getting in the first phase, but
Yes.
maybe like, you know, second, third one.
Phase, yeah.
But yeah, absolutely, I would take the vaccine.
Yeah. I would definitely take it. I mean, it's not just because, of the pandemic and everything. It just makes sense to take it and have your families take it. I'm trying, since I have that knowledge about the vaccine background, I'm trying to talk to my friends and family who have questions about it. And that's why I'm doing this video, because I want people to kind of know about these safety measures and the benefits of taking the vaccine, so that more and more people take it, because we need to take at least 65 to 70% of the country needs to take the vaccine in order to achieve that herd
The
immunity
immunity.
that we're
Yeah.
talking about. Because it's not like, so right now, the question that we have about vaccines also, I wanted to add this, is that they're saying they're not sure if even if you take the vaccine, you can spread it to others or not. So they're saying you won't get sick if you take the vaccine from COVID, but they're still studying if you can spread it to others. So they're still encouraging people to wear the masks even after taking
Of
the
course,
vaccine.
during the pandemic, yeah, you
Yes.
have to take all the
Until,
measures, you know, social distancing, wear the mask, you know,
yeah.
do the,
Still do those things. Yeah. Still do whatever you're doing right now. Even if you get vaccinated,
I know, like, you know,
that's, I mean,
like it says that full safety data, it's not really have been made available yet, and they were being studied as they are given the vaccine, but still, you know, those studies are going through.
yes.
So until we get that full picture, I think everybody should, you know, adhere to those, you know, wearing a mask, like do
Mhm.
the social distancing, you know.
Mhm.
So I
Mhm.
think they should really adhere to those things.
Yeah, definitely. Because don't just, right after taking the vaccine, don't just be thinking that, oh, I'm safe from it, I don't care anymore. You also have to think about the people who are not vaccinated around you, that you can still spread that to someone else. So, I think until the end of 2021, we're still going to have to maintain the same things we're doing now, like avoid gatherings, avoid social, do social distancing, wear the masks, and all those things, and try to stay indoors if you can, and try to work from home and all those things. But yeah, I mean, overall, this is good news. We're all very happy. I know the medical community is very happy with this. The vaccine is getting approved. I just hope more and more people, research and kind of start warming up to the idea of taking the vaccine.
I think, you know, what would happen. This is just the feeling, you know, when you first time, when more people, you know, as gets that, people gonna get sense of more confident about it, you know.
Yes.
Right now it's all novel, you know,
Yeah.
but as it goes through, I think by when we reach by the next year, I think
Yeah.
people would be more comfortable, that
Yeah.
they would see, you know, there will be more studies, there would be, you know, so I think in that sense people will be more confident on
Yeah.
taking the vaccine.
This holiday season is much different than 2019's,
I
right?
know.
And I know, I mean, hopefully, this is, I mean, I'm just praying that this is what happens. 2021 holiday season is going to be much different from this year's, in a good way. I'm just hoping that, we
Everybody's
can
hoping
all
for.
exactly hoping for the best. And I want to thank you so much for joining me today for this discussion. I know it's so late at night. You
You
have
know,
kids.
it's 1:12.
I wanted to talk about, this topic, like I said, just to, do our part in giving people that information.
Exactly. Even, sometimes for me, like, sometimes I post like a lot of information or whatever I get in
Yes.
Instagram or, Facebook.
Mhm.
Because it's like I feel like, as like we were in the, in a medical field, if as it's like you feel like sense of responsibility
Of
that you have
course.
to give this information out there.
Mhm.
So thank you for doing this. I think it was a great idea.
You're welcome.
And
Yeah.
thank you for inviting
Thank you
me.
for
I
joining me.
really
Okay,
have
we'll
to be
see
a
you
part
next
of
time.
this.
Maybe we'll come back with a mom topic next time, and we can talk
I
about
know.
it. Okay, bye, Madhusha.
Alrighty, bye.
If you found this video useful and informative, please give it a thumbs up and subscribe to my channel, and do share this video amongst your friends and families. Hopefully we were able to answer some of your questions, and if you still need more questions to be answered, comment down below and I will get back to you as soon as possible. Once again, thank you so much for showing support to my first ever YouTube video, and hopefully I'll be back soon with another topic. Till then, bye.